Hi everyone, this is Emily Cristobal, and I'm part of Group 6 along with Anna, Giselle, and Lauren, and we will be discussing our adaptation and preparedness plan for the Bahamas in the wake of Hurricane Dorian. First, I'll be taking you through improvements to the built environment in hopes of creating resilient and sustainable infrastructure. For some background, Hurricane Dorian made landfall over the Bahamas as a Category 5 storm in September 2019. Sustained winds were estimated at about 180 miles per hour. The hurricane brought heavy rains and storm surges up to 23 feet to Abaco and Grand Bahama, the second and third most populated islands. The force of the storm caused severe damage to buildings and infrastructure and extensive flooding. Officials report that 13,000 homes were damaged or completely destroyed. Many residents were cut off from power, clean water, sewage, and telecommunications service for weeks, with some of these issues still posing challenges months and years later. Aside from the economic loss and this devastation, the flooding also brought structural damage, the possibility of black mold growing, electrical damages, and in some cases, erosion to the foundation of homes and other infrastructure. This could be seen in the abandonment of some hospitals due to floodwater and sewage contamination. Days after the storm, the World Food Program estimated that about 70,000 people were in need of food and shelter. With these challenges, I wanted to discuss changes needed to key infrastructure, starting with the electrical grid. In implementing solar, a company called RMI is working to create microgrids, a small network that generates electricity for local consumption and can disconnect from the main grid. This means electricity can stay on even if the central grid is down. Plus, the microgrid can either feed electricity into the larger grid or operate independently to power a single facility or a neighborhood. Furthermore, power is usually disseminated through overhead lines. This can lead to severe outages as strong winds or flooding could knock it down. Thus, an effort must also be made to put these electrical lines underground. Another big issue the Bahamas face is access to clean drinking water. On Grand Bahama, salt water from storm surge and flooding overflowed the drinking wells nearly 55,000 residents depend on. To treat the contaminated water, Mercy Corps, an aid organization, use reverse osmosis equipment to purify the salt water. Officials explain that over time, rainfall can slowly repair the contaminated aquifers, but that's only if the wells aren't flooded by rising seas. Thus, a combination of scaling up osmosis, shifting habits to reduce unnecessary water usage, using rain catchment, or treating wastewater for reuse could be long-term solutions to the water crisis. Lastly, we must address roadways, which are crucial not only for commuting but also important in the case of evacuation. With rising sea levels and storms only predicted to worsen with climate change, studies should look into raising roadways as well as adding features to absorb or divert water in the case of flooding. This can include culverts, drainage ditches, or implementing nature-based solutions, like rainwater gardens and vegetated swales. These could not only help filter stormwater, but could also add more green areas along these thoroughfares. In listing these improvements, while they may be expensive, the potential of lost lives, destruction of infrastructure, and crucial resources like clean water are much larger prices to pay in the future.
Hello everyone, my name is Anna Mowris and I'm here to present our comprehensive hurricane evacuation plan for the Bahamas. This plan aims to ensure the safe and efficient evacuation of residents during hurricanes, considering our unique challenges. Our first key component is risk assessment and mapping. We'll conduct surveys to identify high-risk flood zones, focusing on low-lying coastal areas. Using GIS technology, we can create accessible flood risk maps both for authorities and the public. For shelter locations, we'll identify safe, structurally sound areas equipped with necessary supplies. We'll regularly update and publicize the list of shelters. Next, we focus on evacuation routes. Clear multilingual signage will ensure all routes are navigable with regular inspections for visibility. We'll maintain and reinforce key roads and bridges to keep them passable during and after storms. Rapid repair teams will address any post-storm damage immediately. Transportation is vital. We'll arrange for buses and public transport for those without vehicles, coordinating with local agencies for pre-station evacuation buses. Additionally, we'll use boats and ferries to evacuate people from smaller islands, ensuring clear protocols for safe water route evacuations. Effective communication is crucial. We'll implement a robust early warning system using sirens, radio, social media, and SMS alerts. Regular updates on weather, evacuation orders, and shelter locations will be coordinated through a central command center to ensure broad reach. Our plan includes special considerations for vulnerable populations. Assistance programs will help the elderly, disabled, and economically disadvantaged. We'll create a registry of vulnerable individuals and deploy volunteers for necessary aid and transportation. For medical evacuations, we'll ensure rapid evacuation plans for hospitals and care facilities, coordinating with healthcare providers. Community involvement and training are essential. We'll conduct regular training sessions on evacuation procedures, first aid, and emergency preparedness, partnering with local organizations and schools. We'll establish and train volunteer networks to assist with evacuation efforts and support vulnerable populations, ensuring a robust support system. Leveraging technology, we'll develop a mobile app for real-time updates on evacuation routes and shelter locations, ensuring it's user-friendly and accessible. Drones will be used for real-time surveillance of evacuation routes and post-storm damage assessment, enhancing our response capabilities. Post-evacuation support is crucial. We'll develop a plan for safe re-entry of residents, conducting safety assessments and providing clear guidelines. We'll also provide psychological support services, including counseling and support groups, training volunteers in mental health first aid to help residents cope with the trauma of evacuation and the hurricane's aftermath.
Hi, this is Gisselle Sainz, and I'll be going over the plans to adapt to risk for the Bahamas. So first, I wanted to assess the damage caused by Hurricane Dorian in 2019 in order to come up with the best plan of action in terms of what we need to look out for. From using GIS imaging, you can see when we take a closer look that the land around the Bahamas has become inundated by water, and a study actually estimated that as much as 3,000 square kilometers of the Bahamas became completely flooded. And you can also see this extensive flooding at the Grand Bahama Island. Here's the before and after. So now that we understand the risks that we're dealing with, what can be adequately done to adapt to them? There are a few geographic attributes that we can alter for this cause. First, restoring mangroves and coral reefs along the coastlines of the islands can help dissipate the energy from the incoming waves, which helps reduce their impact before they reach inland areas. Constructing seawalls, levees, and comprehensive drainage systems can also counteract the risk of flooding during a hurricane. And to reduce the impact of high wind speeds and minimize destruction, I found the idea of creating a windbreak to be promising. So this can involve planting a dense forest around inhabited areas of the Bahamas, with the trees serving to buffer the impact of strong winds, thereby reducing infrastructural damage and protecting human life. Next, we can also consider the infrastructural design of buildings to be resistant against hurricane damage. So, for example, implementing wind-resistant roofs, windows, and doors can help keep people who are sheltering themselves in times of an emergency. It can help keep them as safe as possible, as well as strengthening the foundations of buildings to make sure that they are anchored down and not budging during a hurricane. And another interesting idea that can be incorporated into our adaptation plan are aerodynamically designed buildings. So essentially, buildings can be constructed with a more rounded, narrow shape to cut through wind more easily and prevent destruction. And lastly, elevating buildings in flood-prone areas can also help prevent damage from rising water levels. In addition to these reinforcements, it is super important to regularly maintain and inspect these structures. We never know when a hurricane will strike, but we can always ensure we are prepared at any given time with the necessary up-to-date reinforcements to protect the population. And while we've discussed several proactive approaches to hurricane adaptation and preparation, the most effective preventative measure is to tackle the root cause of these intensifying weather events, which is climate change. By consistently striving to meet our climate action targets set out in the international frameworks like the Paris Agreement and the Sustainable Development Goals, we could potentially reduce the frequency and severity of such natural disasters.
Hi everyone, this is Abarro, and I'll be talking about public health measures for physical and mental health. In terms of physical health, there are low acuity injuries that don't necessarily require emergency medical care, and high acuity injuries which are critical and do require emergency medical care. A majority of low acuity injuries were lacerations, fractures, blunt trauma, and also aspiration injuries. And some measures that we can take would be to invest in public health education that teaches citizens how to treat small lacerations or fractures, making it common knowledge. And we can also provide emergency medical supply kits that have items such as over-the-counter pain medication, gauze and disinfectant, and any materials citizens would need to help treat the most common injuries. The goal here is to help your neighbor and employ the community where applicable to take pressure off of medical professionals who may have to operate or attend to higher risk patients. For high acuity injuries, the most severe cases dealt with electrocution, lung infections, penetrating trauma, and amputation or crush injuries. Measures that we can take here are to appoint leadership positions and hire specialized personnel that would reduce panic and organize or direct people. We can also provide healthcare professionals with special courses and training that mentally prepares them for the most common injuries so they know what to expect and also how to respond quickly and efficiently. Finally, we can invest in a sufficient amount of resources and medical supplies, such as electrical generators that help power equipment and also an overstock of medical supplies to ensure that we don't run out. The goal here would be taking care of all the little problems so that medical professionals can focus on saving as many lives as possible. Sanitation and infection control were also very big problems, as many survivors recorded chronic lung disorders due to pollution from debris. Learning from what happened last Hurricane Dorian, we can invest in rebuild and cleanup teams, sanitation workers, water and food banks, and also respiratory checkups, oxygen tanks and masks, and any medication needed to treat infections before they worsen or spread. We should remember that all of these resources do cost money, and that it should not only be a community effort, but a global effort, because no country should be alone during natural disasters. In terms of mental health, many problems were seen with extreme, debilitating trauma responses up to 6 months post-impact, mostly from personhood loss, displacement, fear of dying, and loss of loved ones. And symptoms manifested through sleep disorders, panic attacks, major anxiety and depression, and debilitating trauma fixations, such as searching for missing loved ones. We must ensure that mental health professionals are available and accessible, and should not leave it up to survivors to seek out professional help, because it should be assumed during natural disasters like these that people need mental health care and attention. As we also learned from Hurricane Katrina, low-income and disadvantaged communities suffer the most during the recovery period, and therefore it would be helpful to implement policies that actively seek to protect and uplift these vulnerable communities during these times. And along with hiring psychiatrists and disaster psychologists, there should also be specialists in hurricane-related psychopathology to provide survivors with help understanding their PTSD, processing their trauma, developing plans to improve and manage their symptoms, and also to prescribe medication if applicable. And these services should be as affordable as possible or free of charge as funding allows in the name of public welfare. Thank you so much for listening to Group 6's presentation on the Bahamas and Hurricane Dorian, and here are our references.